Before you view our video, take a moment to subscribe our channel, then tap the bell icon so that you will be the first to know when we post new video. 10 weeks pregnant, what to expect? Your baby is now 1¼ inches, about the size of a prune, and can officially be referred to as a fetus. Here's what's happening and what to expect at 10 weeks pregnant. What's my baby doing at 10 weeks pregnant? This week, you'll notice your baby is starting to look more and more like a human, although she's still got a huge bulge on her forehead as her brain develops. Bones and cartilage are forming and your baby is starting to get knees and ankles. Cute, her arms can now flex, but are still so small you wouldn't feel any little punches just yet. Although your little one won't get her pearly whites till she's nearly 6 months old, this week the teeth will start to form under the gums. Your baby is also starting to function like she will on the outside world. The kidneys are producing urine, and if you've got a little boy in there, he'll already be producing testosterone. What is my body doing at 10 weeks pregnant? The surge of pregnancy hormones is really starting to affect your body. The muscles in your bowel have relaxed, and this can often cause constipation. Eating lots of fiber, drinking lots of water, and keeping up the exercise can help. Time to take a look in the mirror, as you might notice the first signs of that growing baby bump this week. Look out for a slight roundness in the lower abdomen as your uterus starts to grow. At the moment it's about the size of an orange. That said, this totally varies person to person, so don't worry if you're not seeing signs yet. You will do in a couple of weeks. The next physical change you might be noticing is your veins looking more prominent than they were before. These will be more obvious if you have fair skin, but can appear on the breasts and abdomen. Again, this is normal and nothing to worry about. It's your body's way of getting all that extra blood to your growing fetus. Other physical changes to look out for are spidery red lines, medically referred to as spider envy, in your upper arm and chest. These are caused by the pregnancy hormone estrogen, which is working to dilate your blood vessels. They usually disappear post-pregnancy, so try not to worry about them just now. Whilst we're talking about pregnancy hormones, it's very common for higher levels of progesterone to cause dry skin or spots, so look out for this too. Common symptoms to look out for. Constipation. We've already spoken about this unpleasant side effect, but it's a common one during the first trimester. Steer clear of foods that will make it worse, like bread, rice and pasta, and focus on packing your diet full of whole grains and fruit. Mood swings. Be warned, those pregnancy mood swings will be felt most during trimester 1 and for the final few months of pregnancy. You'll have a break soon, but for now, get used to feeling rather over-emotional. Fatigue. We've mentioned exercise being important this week, but so is resting. In about a month you'll be feeling less tired, but for now, listen to your body and get an early night or two. Heartburn. Another one you've probably already experienced by week 10, but in order to prevent it, try not to lie down too soon after you finish eating, no matter how tired you may feel. Discharge. Another one caused by those pregnancy hormones. Expect a thin, white, milky discharge as more blood flows to your pelvic area. Another one not to worry about, it's completely harmless. Feeling faint or dizzy. One side effect to all this extra blood pumping around your body is to feel faint or dizzy. Remember to sit down as soon as you feel lightheaded, and to keep your blood sugar levels up by snacking. Round ligament pain. This is a fancy way of saying ligament pain as your belly expands. This can be dull or sharp, but is very normal. The best thing to do is sit down and put your feet up, as it's caused by the growing weight of your baby.